Good morning. Thank you for having me.
Start off at the beginning. MedNow. This is a relatively new program at Spectrum Health that saw a need and asked you to create this program. How did it all begin?
Well, I think people are using their smart devices more and more for all aspects of their life. Mm-hmm. And so why wouldn't the same be for healthcare? So if you don't need to go into the doctor's office for a physical exam, why couldn't you see your doctor on your smartphone or your tablet? And that's really where it started.
That's where it started, yeah. I mean, we see that in movies all the time, but you don't think of it in real life. And for the last, year and a half, this program has been up and operating.
Correct. Yeah, this for those that cold, cough, rash, or flu, the easy stuff, that's what we're connecting provider to patient on their own device.
All right. Now, some people will say, well, but I want to see a doctor, but you don't have the opportunity. Your doctor is office hours, and they're closed. An emergency center, a med center, or something like that, you can't get there. So this gives them another opportunity to see or talk with a real doctor.
Absolutely. 24 hours a day,
Really?
7 days a week.
Really?
Yeah. Our most busy day is generally Sunday. So it's opening up access to primary care, but it's doing when it's most convenient for the patient. You never have to leave your couch.
No.
And if it makes sense that you do this 2 o'clock in the morning, you're able to do it. We see patients 3 years and older.
Okay.
So if your child has something going on in the middle of the night, you have the opportunity to have a visit right then and there without leaving your home.
Is this an app that you literally put on your phone or your iPad or whatever?
You go through the front doors that we have at Spectrum Health, and there is an app that you do for the video connection.
Okay.
But there isn't a specific app yet.
Okay. So you still have to connect through the internet, so to speak.
Correct.
And you go to, help me out, guide me through, you go to MedNow or what?
Right. When you identify that you need to have a MedNow visit, you can either call our 844 number, which is 844-322-7374, and someone will be able to schedule you, just like they schedule an in-office visit.
Okay.
They'll be able to schedule a MedNow visit. If you're an existing Spectrum Health patient or a Priority Health member, you have access to My Health, which is our app.
Right.
And you'll be able to self-schedule. So you can choose the time that works best for you to have this visit.
Okay. Someone says, I need it now. I want to talk to MedNow is what I need.
Right.
So you schedule this, but does that mean within the next 10 minutes or within the hour or something?
Correct. Yeah, average wait time is about 8 minutes.
Really?
But what we found is people want to schedule when it's most convenient for them.
Okay.
So if in the next 10 minutes is not convenient, but you know that you're going to get off of work or be done with a meeting or dropping the kids off at a certain time, you can schedule the time that works best for you.
This is really cool. Joe Brennan is the director of the MedNow, senior director of the MedNow program at Spectrum Health. All right, so walk me through this. So I got a cough. I'm feeling just really bad. I need to see someone to get some. So I've get to MedNow. Now I'm talking to a doctor, right?
Correct.
Who's on my phone.
Correct.
I'm not just talking, but I'm seeing them. It's visual, right? Okay. Or I could use my computer if you have a camera with your computer too.
Correct.
So you're talking to the doctor. Now what am I going through then? I'm telling him my symptoms, and they're diagnosing me?
That's it exactly. It's a series of questions.
Okay.
Obviously, we don't treat everything.
Okay.
We treat the things that are appropriate in this type of environment through what essentially is FaceTime or Skype, but in a secure manner and appropriate for healthcare. But it's a series of questions that our providers go through.
Okay.
And then if a prescription is necessary, then they would send that to the pharmacy.
Okay.
But a care plan and an after-visit summary is then sent to you when you're done. And if an antibiotic or a prescription is necessary, you can go pick it up.
This is amazing to me. I mean, this is new stuff that is actually revolutionizing healthcare in a way, because it's providing to more people and on a moment's notice almost.
Yeah, and more and more of our life is becoming like this.
It is.
And it makes sense that healthcare would do the same. But at the end of the day, it's convenient access. It's easy to do, and it gives you access to care within 10 minutes.
I can now get groceries delivered to my house, and I can get medical care on my phone.
Correct.
All right, now, let's say I have a rash or something, and I'm really worried about it. Can I literally take my phone and hold it up to the rash so the doctor can see it? anything like that.
That's exactly what's happening.
Yeah.
The quality of cameras that are on smart devices these days, on your iPad or your iPhone or your Android, are very, very good. And so providing the opportunity for that provider to lay eyes on your rash, that camera and the technology that we use for video is giving them everything they need in order to make that clinical decision.
That is amazing. All right. So then if they're going to prescribe something for me and you need it now, so there are some 24-hour pharmacies around the area. So I literally could go right to the pharmacy in the next hour and pick it up, right?
Correct. The provider is in our electronic medical record, which is allowing them to place that order.
Okay.
Generally takes about 10 to 15 minutes.
Wow,
So
that's you keep stunning me with all these great things. All right, what about cost?
Well, the original intent was this, to find a lower cost of care. Find something that is a lower price so that we can bring it to everyone. And so many insurance companies cover this. Many insurance companies, it started with Priority Health, but Blue Cross Blue Shield and other insurance companies are paying for it, and some will treat it like a copay for an office visit. But even if your insurance doesn't cover it, it will never be more than $45. So
No
for
kidding.
the convenience and access of being able to see a board-certified licensed provider at 10:30 p.m., it's $45.
That's amazing. It also is helping not spread disease and germs in many ways, because let's say you do have something really serious going on, flu, etc., and you're on the phone, you're video conferencing with your doctor rather than going into an office and hacking and coughing all the way through.
Absolutely. We get a lot of stories from parents who are taking kids in, and they take one child into the office, and then the other two that came along have now come back with something else. So this eliminates that. It's also opening up access within the doctor's offices for those that need more time. Those that have more serious conditions now they're having more time with their provider because the easy stuff, so to speak, is now being done at home.
That's amazing. All right, and it's open to anyone.
Anyone. You do not have to have a relationship with either Spectrum Health or Priority Health. 31% of our users of MedNow are new to the system, and we're statewide. So we have seen patients in all but 3 counties in the state of Michigan.
Is that right? You've stunned me again. All right. We're talking with Joe Brennan, who's the Senior Director of the MedNow program. Then how do I sign up? How does someone walk me through getting set to be able to do this so that I have access to it?
If you already have MyHealth, which Priority Health members and Spectrum Health patients have.
I actually do, as a matter of fact. So.
When you log into MyHealth, it's actually the first tile that you see,
Okay.
and that will allow you to schedule that. But if you have no relationship with Spectrum Health or Priority Health, calling 844-322-7374, someone will get you set up and scheduled.
Is there a website that I can find that number if I'm not able to remember that phone number?
Yes, mednow.spectrumhealth.org.
Simple as that. mednow.spectrumhealth.org. Joe Brennan, MedNow. Fabulous program, Joe, and congratulations on much success. You're having much success right now, and it will only go and grow higher.
That's what we hope for.
That's right. Joe Brennan from MedNow and Spectrum Health.